My name is Mitch Edmondson. I'm a family physician and I practice at Bay Health Primary Care, Milford at Airport Road. Well, I was born at Kent General Hospital and was raised in Smyrna, Delaware, and have always been drawn to the small town atmosphere. My wife and I lived in Northern Virginia for a number of years after we did our military training, and we felt like we wanted to be back into the small town atmosphere, and Milford was a perfect fit for us. I first thought about becoming a doctor when I was in elementary school. I got to see my family doctor working up close in Smyrna, Delaware, where I grew up, and thought about it all through school. When I got to college, I majored in psychology and thought about being a psychologist, but I really thought that medicine was a better fit for me. In our practice, we take a very collaborative approach. I practice with other doctors, physician assistants, and of course front desk personnel, medical assistants, licensed practical nurses, and registered nurses, and even a dietitian. We take a very collaborative approach to taking care of our patients. Our patients rely almost as much on the person who answers the phone and the person who brings them back into the office as they do with me, because they grow to know them and trust them. One of the things that differentiates our practice from some others is our chronic care management team. We have registered nurses and a registered dietitian who help to follow some of our more ill patients, making sure that they get the medication that they need, that they get the specialty services that they need in a timely manner, and then when they're ill, that they can get in to see me in a timely manner so they don't have to go to the emergency room and they don't need to be admitted unnecessarily. One of the things that's special for me is that I get to practice with my wife, who is also a family physician. We started practicing together in the military, where we were both assigned to the same Air Force base. It's been a very special thing for me to be able to practice with my wife. And as we continued in our practice and in our professional development, we really knew that we wanted to practice together. My relationship with my patients really builds over time. Ideally, a family doctor should have a long-term relationship with their patients. We see patients go through the transitions of their lives as they grow up, as they get married, have children, grow old, and go through some of the most difficult times in their lives. So my patients really need to be able to trust me and know that I'm going to be there. And that only happens over time, where people have that experience of knowing that when they need help, that they'll be able to call me and I'll be able to provide the help that they need.